Sup folks, welcome back to Neurosketch with Dr. Kenny, and if this is the first contact, don't forget to subscribe. Today we are talking about the oblique muscles. So forget about the straight lines. The oblique muscles are so dramatic, they move in diagonal, and they're just here to complicate our life. So let's dive together as we uncover the secrets behind the oblique muscles. Before we go straight to the oblique muscles, let's first see the different axes through the eye. The different axes through the eye rotates, through the eye moves. So we have three axes, and number one is anterior posterior axis, the axis that comes from the anterior part of the eye and goes through the eye to the posterior. So we have this axis, and through this axis they made two movements possible. Number one, it is rotation along the axis to the medial side. So the rotation to the medial side will be in torsion. So the medial rotation along the anterior posterior line will be in torsion, and then the lateral rotation along the anterior posterior line, that will be extorsion. So this is extorsion, this is intorsion. Through what? Through the anterior posterior line. But we can also have the vertical axis, and then under the vertical axis the eye can either move lateral to the vertical axis or medial to the vertical axis. So this is the vertical axis. So if the eye moves medial to the vertical axis, that will be adduction. If the eye moves lateral to the vertical axis, that will be abduction. So that should be abduction. So along the vertical line we can have adduction or abduction. And then we also have a horizontal axis, that go through the side. And under horizontal axis, the eye can either move above the line or below the line. So the movement of the eye above the horizontal axis will be the elevation, as in elevation of the upper of the globe. And then the movement of the eye below the horizontal axis will be depression. So we have three axes that the eye will move along. So and so this is what I thought I would put it today, because for you to understand the intorsion and the extorsion and all that eye movement. Okay, so because these oblique muscles are so dramatic and they have most of these movements, and it is hard if you don't remember. So of course this one is discussed somewhere else, and so let's now dive into the oblique muscles. So the oblique muscles, they are so called oblique because they insert through an angle, and assume the oblique, the optical axis is somewhere here through the fovea centralis, the pupil through the fovea centralis, and then the muscle they insert through an angle. For example, this is the superior oblique muscle. So this is the superior oblique muscle. So it inserts with a large angle, and that angle is what makes it oblique, because oblique means diagonal. It is diagonal to the axis of through the optical axis. So this angle also complicates our lives, at least more than what we expected in the superior and inferior oblique, superior and inferior recti muscles. This angle in the superior and inferior oblique, it is so much complicating, and of course, it changes everything. Okay, so the superior oblique muscle will come from the body of the sphenoid bone, somewhere around here, just medial to the common tendinous ring of Zinn, and then it doesn't go straight to the eye. See, just to make your life miserable, it goes somewhere. It needs to be unique, so it goes somewhere and through the trochlea, which acts as the pupil. So it acts as the pupil system, and then it makes a turn. To come to to be inserted just below, deep within the superior rectus muscle. So it goes through the pupil to come here. So the action of the superior oblique muscle will always be complicated. It will not be the same as the action of the superior rectus, because this one has already gone to this side. Same applies. Now these two muscles are so dramatic and they can make your life miserable at times. So inferior oblique same applies. Instead of, how unique this is, inferior oblique is, instead all other muscles, they originate from posterior, behind, so assume this is the eye, so all the muscles, they are originating somewhere around behind. And then the inferior oblique, to be unique, just to be pronounced, it originates from the floor of, the medial side of the orbit. So the orbit, assume so now we have an orbit somewhere around here, and then it originates from the medial side of the floor of the orbit, just to make your life miserable, right? Okay. So what problems do you have now? Because the superior oblique muscle will come through the pupil. So the movement, and see where it inserts itself not on the superior aspect. Remember, it does not inset on the superior aspect, it inserts on superior lateral side, the superior but on the lateral side. And then this also changes everything. It changes everything. Okay, same applies. The inferior oblique does not insert on the inferior surface. It doesn't go straight to the inferior, oblique to the inferior. It goes to find somewhere attachment deep within the lateral rectus muscle. So it inserts deep to the lateral rectus muscle. So it is on the inferolateral side, deep within the lateral rectus muscle. And then see this, the superior oblique also inserts itself deep within the superior rectus muscle, by where at the superolateral aspect of the globe. So let's assume we are talking about the superior oblique muscle. So contraction of the superior oblique muscle will result into pulling towards the origin, because we are pulling the insertion towards the origin. But this pulling does not transmit directly to the pulling of the of the globe. So it pulls the pupil, and then the pupil will pull. The pupil, now the trochlea, will pull this muscle in this direction. So this one will never ever result into elevation of the globe. So under superior rectus muscle, pulling the superior rectus muscle would always result into elevation. But pulling the superior oblique muscle will never ever result into elevation, because I'm pulling this side. So if I'm pulling this side, I will get depression. See now how it comes, where the confusion comes, because it will result into depression. But because it's on the lateral side, of course we can dissolve this force. So assume we are pulling from this part, pulling this part here, so we can dissolve this force into horizontal and vertical component, and so that's the horizontal and vertical component. So we have the force that is pulling this point upward, and we have the force that pulling this point horizontally. So here's what happens, guys. So this is the globe. This is the eye. Assume this is the, what is it? Is it to the right? So this is the right eye. Okay, because this is the right eye. Okay, so the superior oblique muscle will go to insert somewhere around here, just behind, on the lateral side. To insert here. So pulling this muscle, number one, it will rotate the eye, it will rotate the globe medially. So it will have the medial rotation, because it inserts somewhere here. So if it is pulled toward the pupil, it is pulled toward the anterior side, and it is on the lateral side, it will result into intorsion. So it will immediately rotate the eye, and that is intorsion. That's number one. But because it is somewhere around here, superolateral, it will result into depression of the eye. So when you're pulling from this point, it will result into depression. So of course, number one, we will have lateral rotation. So we have the medial rotation, because this is the right eye. So we have the medial rotation and depression. So medial rotation depression. But it is more than that, you know, because there's also somewhere here when you pull it. So see, pulling from this point, because you can say somewhere here, pulling, it will result into medial rotation and of course depression. The eye will go downward, not upward. Depression, but it is superior, but yet it depresses the eyeball. Okay, so depression. And then the last thing that it will do, it will abduct the eye. So we have three movements by the superior oblique muscle. Number one is intorsion, and it is powerful intorsion. I mean, it is a powerful medial rotator of the eye. Medial rotator, I don't know if the intorta is the correct terminology, but it is. I would say it is powerful intorta, with the powerful rotator of the globe, the powerful medial rotator. And then, so we have three muscles under three movements under superior oblique muscles. Yes, number one is medial rotation. Number two is depression. Number three is abduction. So and these are the movement through those three different planes that I've just explained, three different axes that I've just explained. So what about the inferior oblique muscle? So then if you put the inferior oblique muscle, you are pulling towards this direction, and because it is inserted, assume now this is the right eye, so the inferior oblique comes from somewhere here to insert this point. So pulling this point towards this side, it will result into lateral rotation. Easy peasy, right? So that is extorsion. So it results into extorsion, number one. But because we are pulling this side to let it down, so this muscle will elevate. This eyeball will elevate, and so the inferior oblique muscle will elevate the eyeball. So number one, it will laterally rotate. That is extorsion, and then it will elevate. That is elevation. And then, because also it's inserted on this side and we are pulling towards this side, it will have a little bit of abduction. So, three movements under inferior oblique muscle. Number one will be extorsion, elevation, and abduction. Extorsion, elevation, and abduction. But the abduction by both superior and inferior oblique muscles, they are weak abduction. They are not like chief abductors, so they are weak abduction. But these two muscles are chief. The superior oblique muscle is the chief medial rotator. The chief medial rotator are intorsion, and the inferior oblique muscle is the chief lateral rotator. Why? Because of the position that they are, because it comes somewhere from here. So when you pull it, they will have a powerful medial rotation, and when you pull from this inferior oblique muscle, we have a powerful lateral rotation. I've used most of my time discussing here because I know how miserable this your life could be from these two muscles. Okay, so yeah, so that's it. So okay, so I want to summarize. So of course, intorsion, I told you the other time, intorsion is the medial rotation. So this is the left eye. Intorsion will mean you are observing the 12 o'clock position. This is the 12 o'clock position. If the 12 o'clock position moves medially, that is intorsion. But if the 12 o'clock position moves laterally, that is extorsion. So look at this. So that is a movement towards the 12 o'clock position has moved medially, has rotated medially, so that is intorsion. But if the 12 o'clock position rotates laterally, that would be the extorsion. So that is extorsion. Okay, so let's go back to primary gaze. So that's the primary gaze. That's primary gaze. Okay, so let's summarize now. The superior oblique muscle, it will originate from the body of the Stephen bone, just medial to the common tendinous ring, and then the inferior oblique muscle will originate from the anterior part of the floor of the orbit, anterior but on the medial side. So it comes from the medial to insert to the lateral. So this is the inferior oblique muscle. The inferior oblique muscle will come from somewhere from here to insert somewhere here. So it comes from the anterior medial part of the floor of the orbit, and it inserts on the posterior aspect. And then the insertion of the superior oblique, we have said it is deep within the superior rectus muscle and on the superolateral aspect, the superolateral surface of the eyeball, whereas the insertion of the inferior oblique, it is deep to the lateral rectus on the inferolateral aspect, and then the innervation, we go back to the formula. superior oblique by 4. So the superior oblique muscle will be innervated by the trochlear nerve, which is cranial nerve number 4. But what about the inferior oblique? The inferior oblique is found under others, and others are all supplied. They are all supplied by the oculomotor nerve, which is cranial nerve number 3. Oculomotor nerve, which is cranial nerve number 3. So what about that's oculomotor nerve, which is cranial nerve number 3. So what about the action of the superior oblique muscle? We have said it will, number 1, it will result in, it is a powerful, the primary action is intorsion. So it is a powerful intorter, we can say, but it also depresses the eyeball and it abducts it. It depresses and abducts. What about the oblique, the inferior oblique muscle? The inferior oblique muscle will result into extorsion. It is a powerful extorter. So powerful extorsion, but elevation and abduction. So both the superior and the inferior oblique muscles will do abduction. But remember, the superior and the inferior recti muscle, they were doing adduction. And superior oblique muscle is a powerful intorter, and the inferior oblique muscle is a powerful extorter, a powerful radial rotator. This is a powerful medial rotator. But this is on superior side, but it does depression, so it does not coincide with the name. So the name superior does not mean that it is set on superior aspect. It means it's oblique muscle. One is superior, one is inferior, and that's it. So what are the names that supply these two muscles? Of course, we have already seen that the lateral rectus, the superior oblique muscle, will be innervated by cranial nerve number 4, and the cranial nerve number 4, this one is the cranial nerve number 4, which is a trochlear nerve, comes from the posterior aspect of the midbrain, the only nerve to exit from the posterior aspect, and then it goes to supply only one muscle, and that's superior oblique muscle. No stories. And then what about the inferior oblique? So the inferior oblique receives innervation from the inferior division of the oculomotor nerve, which is cranial nerve number 4. So just to summarize, all the muscles, putting all together, all the muscles of the extraocular muscles, we say the superior rectus muscle, so number 1, the medial rectus and the lateral rectus, we say they are perfect straight, so they have no stories. They will only do one thing and one job only. And the medial rectus will adduct, so we do adduction, and the lateral rectus will do the abduction. They have no stories. But remember, the superior rectus muscle, it will elevate and medial rotate and adduct. So elevate, medial rotate and adduct. But the inferior rectus will depress, and will depress the eyeball, laterally rotate, which is extorsion, and also adduct. Remember the previous video. And the superior rectus, the superior oblique, we've just seen it today. The superior oblique will medial rotation, the intorsion, depression, and abduction. Intorsion, depression, and abduction. What about the inferior rectus muscle? The inferior oblique muscle. The inferior oblique muscle will extort, so will laterally rotate, elevate, and abduct. Laterally rotate, elevate, and abduct. You can use any of the picture that you find it's useful. So this is it about the discussion on the extraocular muscles. All of the extraocular muscles are covered already. So next time we meet, we discuss about the clinical qualities. Don't forget, if at all you want to, you should never ever forget the you know the foreign part, the clinical part, because that's the most important of all things. So until we meet again, see you next time.